So good evening, guys. Thank you all for being here. Every Tuesday, most every Tuesday, if there's 5 Tuesdays in the month, the 5th Tuesday we may do a specialty class that someone has requested. But every Tuesday we do. It's okay, don't worry about it. We do a workshop at 6:30. It's 30 minutes of information to help you to understand where things are going. It's open to the community, so if you want to bring guests, please do so. It is sometimes basic information that you may or may not heard, but you may get a tidbit or a nugget of information that you would take with you and that you have not heard before, or maybe it's something that just reiterates what you've heard before. My hope is with this that you understand that ultimately, in order to stay healthy, it's up to you. I mean, it really is up to you to decide where you're going to go, the choices that you make. And you know, as a chiropractor, as a doctor of chiropractic, my job here is to really look at the true functionality and exposure of your body to the things that cause problems and to make sure that they're functioning at their best. And those are the keys, and that's why patients that come in aren't just coming in because they have aches and pains, but they're coming in to make sure their bodies are functioning better. And then we start talking about many of the other myriads of things that are going on, but it's not just about the pain, but functionality. Having said that, there's a lot of information that you're going to see tonight, and we're going to talk a little bit about asthma and allergies. We're going to talk about the basics, and then I'm going to talk about some things you may be able to do. I'm going to show you some studies from a chiropractic standpoint, but I'm also going to talk about some herbals and supplements that may or may not help. And those are the things that we look at. And that's why people come in, because this is open to the community, because people need to understand. We want a healthier community. We want people around us to understand why they're doing the things that they're doing. So having said that, I'm going to start with that. Can everybody see that? Yes? Thank you. So asthma. So first we have to understand what these things are before we can actually understand where, where we need to go in order to take care of them. According to Better Health and Medical Network, asthma is a chronic lung disease with inflammation and or obstruction of the airways from the nose and mouth to the lungs. So basically, you can't breathe. I can remember many, many years ago, before my dad passed away, I went home one time, and he was having trouble. He had COPD, and he came out on a Sunday morning. I happened to be there that weekend, and he goes, "I can't breathe." He goes, he was sucking air, I mean, he was really having trouble breathing. That's absolutely the extreme end of something. But he looked at me and he goes, "You don't understand," and then he stopped, because I was an asthmatic growing up. And I used to have that happen to me. So it's really, really important understanding what it is that you can do for it and what can be done for it. 4 million children under the age of 18 suffer with asthma. Asthma has increased 46% from 82 to 93, with an 80% growth in children under 18. That's pretty dramatic, and these are from these statistics are from years ago. Any new statistics that you're going to get is usually about 10 years old. So I haven't seen the most recent ones, but these are the ones that I was able to find. In the 5 to 17 age group, asthma causes an annual loss of more than 10 million school days per year. That's a lot. Okay, one of the things is, think about those individuals that are going to work and the productivity that's lost in doing those things. Asthma accounts for more childhood hospitalizations than any other childhood disease. Children with asthma spend approximately 7.3 million days per year restricted to bed rest. And in 1990, there was 7.1 million physician visits for asthma. Not just children, adults also. Okay? Healthcare costs for asthma were estimated to be about $6.2 billion, which is almost 1% of the total U.S. healthcare costs. That's a lot of money to spend on something that. What is the usual treatment for asthma? What do they usually do for you? Inhalers, right? Inhalers are a usual thing that they do for it. Not that they're a bad thing. You really have to learn how to and when to use them. And there are some things. When I grew up, I used a lot of different inhalers. And none of them really ever had long-lasting effects. They were just a short-term effect because they were never treating the causes of the problems. More than 5,200 Americans died from asthma in 1991, so that's quite a bit. People with asthma have extra sensitive or hyperresponsive airways. The airways react by narrowing or obstructing when they become irritated. This makes it difficult for the air to move in and out, and this narrowing or obstruction can cause one or a combination of the following symptoms. Now I'm going to go over those symptoms. One of the things that you will see in a lot of asthmatics is they're barrel chested. They have very large chests because what happens is the air sort of gets trapped inside and they have trouble expressing it. So one of the exercises that you can really focus on, especially if you're an asthmatic, is actually blowing out. Is actually forcefully blowing out air to exercise the lung enough to squeeze down and get the air out, and then be able to inhale a full lungful. Okay, so it's very, very important. So it's a simple exercise, but it's not easy because sometimes when you breathe out that hard, you start coughing. And you start, and some people cough to the extent where they may throw up. Okay, I mean it's really something that you have to look at. But if you can help with expressing the air after you've inhaled, that helps with the whole mechanism of the muscles of the ribs and moving of the ribs. As we get older, one of the other things that attributes to asthma is that the cartilage that's along the sternum here. The ribs wrap around and there's cartilage that's along the sternum here. It actually starts to ossify or turn harder and become more like bone. So what happens is you have trouble expanding your chest as much. So you have to make sure that if you sit at a workstation and you're down like this all day, that you're stretching it out and expressing it and opening up the chest, because this will allow for expansion too. So some of those things are things that you can do. Following symptoms may occur: wheezing and coughing, shortness of breath, chest tightness. Narrowing or obstruction is caused by airway inflammation, meaning that the airways in the lungs become red or swollen and narrow, and the bronchial constriction. This one here is really scary because it's actually the muscles spasming around in your lungs. So there's a lot of different things that can come from that. I was just reading an article in Scientific American Mind, and they would talk about psychosomatic effects and how you can really, really, really help yourself by working on the psychological effects, not just with asthma, but there were several other things that they approach. And it's not just psychosomatic, but that's a good portion of understanding how you can breathe and how you can do those things. One of the things I learned as an asthmatic growing up was, if I had an attack, was to try to work on my breathing and really, really, really focus. I had to find a point. It's almost like a meditation, and focus on it. When you're really restricted, obviously, you don't want to take the risk of something happening, but if you can focus on a specific point and calm your body, it allows for those muscles and the respiratory function to come open and work on that. So airway inflammation looks something like this. Okay, this picture shows an opening of a normal airway on the right, which is this. And here, this is the swelling. You see the inflammation around it? So on the right, this picture has been exposed to a certain stimulus, and we're going to talk a little bit about that allergen like grass pollen, and basically it becomes swollen and plugged. Sometimes mucus will get in there, and that's when children may have a mucus plug. That's why coughing is important. It's a normal reaction of the body. Sometimes, when people get colds and they're coughing a lot, they suppress the cough. There's a time and place for that, but naturally your body is trying to expel something that's in there. And with a child, if they're not expelling the mucus, they can actually get pneumonia because it'll plug up, they'll get a mucus plug, and their chest will actually fill with water. So you have to make sure that things are moving around in there. One of my friends, I remember when I was going to school, and he worked on the docks in New Jersey. He was a big boy, and one time, and I was having I had some bronchial stuff going on. One time when I was in school, a lot of stress, I had gotten sick. And he goes, "Oh, come here." And he starts smacking me in my rib cage over here. And he goes, "You just gotta cup it and get it moving." I'm like, "Dude, stop, you're hurting me." Okay, but I started coughing and things started coming up, and I was like, okay, I get it. So it was the vibratory stuff. I'm not saying go around and smack people in the rib, but it was the vibratory stuff that was going on, in his body, in the body, that was actually breaking things loose. Okay, you can do that different ways. You can do that with breathing mechanisms, with going into a shower, hot shower. It's almost like a nebulizer. You get that steam going in there, and do breathing exercise. It helps to relieve those types of things. So those are the things that that we want to be aware of. And then obviously in children, it's It's more relevant because they're small, their lungs, their pathways are smaller. Bronchial constriction looks a little different because the muscle around it tightens and then restricts on it. That's a little more dangerous because you don't know why it's restricting. Could it be because the nerves that are going to that area are interfered with? Possibly, and that's, as a chiropractor, that's what we look at. But it's, there is actually a study that shows when you get adjusted a specific way, that there's a respiratory burst, which allows the body to, it literally sends a respiratory burst into all the cells in the body, so it allows you to breathe easier. And for me, being an asthmatic, I used to feel that all the time. I was taking 4 medications for asthma and allergies up until the age of 25, and I'm going to be 50 next week. Hi, honey. I'm going to be 50 next week, and I haven't taken anything in 25 years. So it's really important. And in 25 years, I've had 2 asthma attacks. Okay, and they were both in the beginning stages of triathlons that I was doing in the last 5 years. Hit the water. Water was probably in the 50s. When I hit the water and I started swimming, all of a sudden I could feel a constriction on my chest. And I was like, oh, there's something wrong, and I stopped and got out, had an asthma attack, then went home that night, and both times I had 102 fever. So it wasn't just something else was going on in my body that was trying to tell me, hey, you shouldn't be in the water. And I was not smart enough to listen, until I got in the water. So be aware of what's going on. The fever was there for a reason afterwards because it was burning off whatever was going on. So this is just, you got to be very careful. And this is where you really have to focus on relaxing your body and having that mental okay, I got to relax, because it will allow you to relax those airways. Provoking factors. There are triggers which result in tightening of the airways, which is bronchoconstriction. And then there are causes or inducers result in inflammation of the airways. So you'll understand the difference, I hope. There's differences. The triggers actually tighten the muscles, and the causes actually inflame the inside. So there are differences in what's going on. Triggers. Irritate the airways and result in bronchoconstriction, do not cause inflammation, and therefore do not cause asthma. It can be misconstrued as asthma. Those triggers aren't causing asthma. There's something else going on that's restricting the muscles. Symptoms of bronchoconstriction caused by triggers tend to be immediate, short-lived, and rapidly reversible. Airways will react more quickly to triggers if inflammation is already present in the airways. So this is pretty much common sense. If you have inflammation in there and then you have some sort of trigger that restricts, yeah, guess what? It's going to be worse. So you have to, it's almost trying to figure out what's going on. Common triggers, cold air. I hear this a lot with my friends who run triathlons. They're out in the cold, and I don't like running in the cold. I can't breathe. Okay, that makes sense because the lungs may constrict doing that. Dust, strong fumes, exercise, and inhaled irritants. Have you ever heard the term exercise-induced asthma? This is usually what it is. It's a trigger that's causing bronchoconstriction. It's not really asthma. It's just the body trying to react to it. Okay, unless there's some inflammatory response that's going on inside. Emotional upsets, and any one of these, and this is the psychosomatic portion of it. Okay, so any one of these can cause that. Common triggers, others are smoke. Smoke acts as a very strong trigger. Secondhand smoke has been shown to aggravate asthma symptoms, especially in children. The effects of one cigarette linger in the home for 7 days, and therefore it is very important to provide a smoke-free home for all children. This is really, really important, and it's interesting. Like I said, I was an asthmatic growing up. Both my parents smoked. And my father smoked like 3-4 packs a day, and my mother smoked like 2 when I was gone. So I wondered to myself, okay, was it really that I had asthma, or was it just damaging from the secondhand smoke? I myself smoked, and I stopped when I was 25. I used to smoke 2 packs a day, and I stopped cold turkey. And since then, my lungs have really, really changed, obviously, for obvious reasons. And it's interesting because you have different outlooks on it. I mean, I used to smoke and go work out. Go figure that one out. I'd be like, oh, I'm done working out when we smoke cigarettes. I mean, it made no sense, and I was always interested in health, but for some reason I just did it. It was just like, I was like, okay, let me do this, but this is really important to understand because that's really a common trigger. Even people that smoke and it lingers on their clothes, Have you ever been, yeah, your face was priceless. It's like, yeah, even that can affect you, it can be a trigger. So, children should not be exposed to a polluted environment over which they have no control. Unfortunately, outside they can't control, but a lot of kids in cities. I grew up in New York City, that's another factor. I mean, there's a lot of pollutants in the air. So you have to be very, very careful. It's interesting, I remember one time Julie and I it was a long time ago. I can remember her saying, I can't believe, like, she blew her nose and black came out. And we were in the city for like a few days staying there at someone's apartment. And it was like, wow. The body was doing what it was supposed to do. It was trying to keep that stuff from going inside, some stuff up there, and then you blow it up and a black comes out. That's scary, because people are inhaling that stuff every day. Okay, so if you have stuff like that going on, and you're in an environment where you're exposed to those things, put a mask on. Put one of those little masks on. Yeah, does it look funny? Who cares? It's your health. So those are the things we're like. Causes or induces. In contrast to triggers, induces cause both airway inflammation and airway hyperresponsiveness, and hence are recognized as causes of asthma. So this is the difference. There's a huge difference in that. Induces result in symptoms which may last longer, are delayed, and less easily reversible than these caused by triggers. Why is that? Because they sit in your lungs. Okay, they stay there. It's not like you can easily expel them. So allergens, respiratory viral infections are another one that may be common to this aspect of it. Allergens, inhalant allergens are the most important inducer or cause of inflammation and airway hyperresponsiveness. Probably 75 to 80% of young asthmatics are allergic. Okay, so they have that. So this is why the allergies ties into this, especially now, this time of year. You have a lot of that stuff, so you have to teach them. But interestingly enough, I can remember I started getting adjusted when I was 25. I still lived in New York, and my allergies never really bothered me. Periodically, I would get some stuff in my body, and I would clear it out using a neti pot. Has anybody ever used a neti pot? You don't like that, huh?
I've never done it. It just looks gross.
But it does clean out stuff. So I and I didn't really have many problems. Then I moved to Georgia to go to school, and there's different allergens there. So my body had to learn how to adapt to those allergens. The first year I was there, my body did respond pretty much, not really bad, but it did respond. And then as it learned the allergens and how to fight them, my body wasn't over-responding anymore. It knew exactly what to do. So the thing is, you have to look at what you're being exposed to. Is it new, or is it something that you're used to and your body just hasn't become accustomed to dealing with? Your body should be able to adapt to the difference and changes, but it may take time for that to happen. So those are the things that we look at from there. And then he pops up there. Common inhaled allergens. I was on the radio this morning, and they were asking me what was in season. I go, I don't look at the allergen chart and see what's in season. I mean, I don't know what's in season. I just know there's an allergen out there. You got to make sure your body has the best ability to heal. So common inhaled allergens are grasses, trees, and weeds. Molds. This is a big one because the molds are very dangerous. Certain ones are very, very dangerous, and you have to be careful of it if it's in the household. House dust mites and house dust mites. Other ones, animal secretions. Cats and horses tend to be the most allergenic causing. That's why I have a dog. No, excuse me. But I love cats. I love horses. But these, because of the dander and because of the stuff that's coming off them, they're most commonly the cause of things that may go on. Aren't they cute? Exposure to an allergen may cause immediate symptoms such as wheeze and cough. This causes airways are hyperresponsive and react by tightening. I see these commercials now for the EpiPens, and I'm not saying that they're not important, but when I was growing up, there was never that much response that people needed. There wasn't as many things going on. So that's the question that comes to mind for me. Why are people more sensitive to this stuff? Why are they more hypersensitive to glutens? Why are they more sensitive to allergens all of a sudden? What have we been doing over the last 40 years? Food is part of it. Food is a big part of it.
A lot, it's not, like when we grew up, it was real food. Right?
Oh, yeah, the process, oh yeah,
All
absolutely.
the process. I mean,
Yep.
a lot of kids just eat at McDonald's. The parents are running here, running there.
Yeah.
They don't know what a real meal
Right,
is.
and that's and there's a lot of things that happen out there, a lot of the processed foods, and free foods. And that's a whole nother series of workshops we do. We do nutritional workshops on that
I
stuff.
think ADD has a lot to do with
Yeah.
that.
Well, you know, the other thing is too, the schedule of vaccinations has increased immensely. When I was growing up, like I said, I'm 50, yes, I was vaccinated, but we had maybe 12 to 18 doses, okay, by the time I was 6. Now, the number by the age of 2 is 36. By the time we're 18, it's somewhere in the vicinity of 78 to 80. So your body never learned how to react to things. It doesn't know how to respond. It's like kids should be playing in the dirt. They should be, I mean, yes, you want to clean them afterwards, but they should be exposed to this stuff. That's how the body learns. And that's part of it too. The foods are lacking in nutrients. The foods are, I mean, that's a big one. And we talk about that in one of the other workshops, but I could go off on a whole tangent on that, but I'm not going to. I'm not going to, but it is very true. It is very true. However, about 4 to 7 to 8 hours after exposure to the secretion, a late response may occur, which is caused by the inflammation. This inflammation develops over time because the late response is often difficult for the patient and physician to identify what is actually causing the asthma. So, relating to food, I sometimes will tell people to get an IgG90 test. It's an immunoglobulin test that tests for food hypersensitivities. And it's a delayed hypersensitivity. It usually takes 2 days. And then it gives you an idea of what foods you're actually allergic to. And usually the foods that we crave, we're allergic to. Okay, and they will cause inflammatory responses and things going on in your body. And we do a whole workshop on reduction of inflammatory foods, reducing inflammatory foods. So,
What about ice cream? Whenever I eat ice cream, I start coughing.
dairy. It's the dairy. Dairy is mucus forming.
But anything cold does that to me if I
Well, you
swallow
might
it.
have a hypersensitivity to cold. If it's anything cold, if you said just ice cream, I would say it was a dairy. But if it's cold,
No, 'cause I take lactate for it.
okay. So the thing is, if it's something cold, it might be a response, a hypersensitivity response or a sympathetic response in your body. And it would be hard to say what specifically, but that's
I cough almost like you say when somebody coughs to get sick.
Mm-hmm.
That's what happens.
Yeah, you might have a sensitivity that came up over the years, or there might be something going on in your neurology that's responding that way. It's hard to say, but that's usually a sympathetic response. It's not a parasympathetic, it's a fight or flight type response telling you don't do that. So that's the thing. Like, I don't drink really ice cold water, I drink it room temperature. Okay, and people are like, really? I'm like, yeah. I cannot drink iced coffee. I cannot drink iced coffee, it tastes horrible to me. I don't know how people drink it, but people drink it. And I like coffee, that's my one big vice. That's my life. Respiratory viral infections, especially in children, may cause a deterioration in the child's asthma. Respiratory viral infection is probably one of the most common causes of asthma. In some cases, the influenza vaccine is given, however, this vaccination is contraindicated for those individuals who have allergies to eggs. So sometimes they do that to try to treat it, but it's not really treatment. They're just trying to, it doesn't make sense, but I put all the information in there so people understand that. But this is a key thing. One of the things we do when we get stuffed up is we take something to dry it up so we can breathe easier. But then the allergen just bypasses all the mucous membrane, goes right into the chest, and guess what? You get a viral infection. So you have to be very, very careful of those. Allergy is an abnormal reaction by your body to substances which you are sensitized to. And this is the key here. You may not have an allergy to something, but you may eventually get one if you become sensitized to it. If you eat a lot of it and your body sort of has to respond in constantly processing it, okay, it will overreact to it sometimes. So those are huge things that you look at. Each time the allergic person comes in contact with an allergen, after that first contact, certain cells in the body release chemical substances called mediators. Mediators like histamine and leukotrienes can cause one or more of the following symptoms: redness, swelling, itching, and increased mucus production. With an allergy to pollens, there may be itchy eyes and runny nose. With an allergy to cats, there may be itchy eyes and swelling in the lungs. The most, it's funny, has anybody ever heard of RH factor? Okay, you know what that is? That's a reaction to a parasite in your body. After the first birth, what happens is the RH factor actually attacks the baby. Okay, And if it's not, if it doesn't agree with the mother, the person may have a miscarriage or something like that, because it's the body's reaction to it. That's an extreme case of this, because it's something that your body becomes sensitized to. I was an Rh negative baby, so my mom, were not compatible. Okay, but somehow I survived. I don't know how, but that's a big portion of it. So allergens are something that you become sensitized to, and that's why I was talking about the medications, the foods. What happens is we desensitize to certain things, but then the body responds by over-responding. You know, so those are the things that we look at. Individual signs and symptoms, not necessarily the same result in all people. Why is that? Because different people have different weaknesses. Okay, from a chiropractic standpoint, we look for the subluxations or the misalignments that may direct us in the direction of where those things are. Tendency to be allergic is inherited. The tendency to be allergic may be inherited. The actual allergy itself is not inherited. So what this is saying, we do a whole workshop on epigenetics, is saying that the gene may be in your body, but it's not necessarily triggered unless you're exposed to it. Okay, and that again, I do a whole workshop, like I said, on epigenetics and genes, so that's something that we look at. Allergic reaction in the immune system can be caused by ingesting substances that enter your body by mouth. Inhalants, the allergen is breathed in through the nose or mouth, which is all the pollen and stuff that we don't want. Or contact allergies, which is like a contact dermatitis or a skin type of thing, and may enter the body through the skin, so sometimes it goes through. And other factors may aggravate the allergy. You know, there's a lot of other factors that you may have. Go. Thank you. Two main ingestions are food, and we were just talking about that. If you eat, like, I love garlic. Absolutely love garlic. I love garlic. I can eat garlic raw. I mean, I just love the way it tastes. I found out that I'm actually allergic to garlic. I have a hypersensitivity reaction to garlic if I eat it. But what I ended up doing was I actually sort of experimented to find out what it was that I was really allergic to. It was actually in combination with pizza and dairy. Okay, because whenever I had garlic with pizza, like the dried granulated powder, okay, I would get lethargic and I'd be like, I'm gonna fall asleep. Okay, that's a symptom or sign of being allergic to a food.
Are you sure it wasn't the pizza that did that to you?
No, I tried it without it because I ate the pizza. I experiment on myself all the
That
time.
was a horrible experiment.
Okay, okay, because I ate the pizza without garlic and then I ate it with. But if it's fresh garlic, it's fine. It's just the dry granulated stuff I found out, and I used to eat a lot of that. So I found out. So the thing is, and there's a couple other things too. You know, so the thing is, you have to. It's sort of trying to figure out your body and what your body responds to. If you eat something, you become lethargic afterward. You may have an allergy to something that's in the food. Okay, if you eat and you feel good afterwards and you're not falling asleep, guess what? That food is actually good for you. Okay, so the thing is, you shouldn't eat for what's there in front of you to satiate. You should eat for how your body feels afterwards. Okay, so those are the big things that we look at, but none of us do that. Certain drugs, you know, people are allergic to certain drugs. I found out, I don't take medications, but I found out one day we went to the hospital and I was having some sort of, I don't remember what it was for. I think it was after I burst my eardrums, and a few days later I went to the hospital and they gave me Dilaudid, which is a painkiller. And I was sitting on the table, I started getting antsy and jittery, and they looked at, you okay? I'm like, I go, no, I gotta leave, I can't stay, I was walking, I was pacing. They're like, oh, you're allergic to Dilaudid. They gave me Benadryl, of course, one drug for another, you know, but they gave me the Benadryl and I did calm down afterwards. But I would have never known. Okay, but my body is very sensitive to that stuff now because I don't take any medications. So it's very important to understand. Inhalants are protein substances breathed in through the nose, and there are different kinds of inhalant allergens. Pollens, like we talked about earlier, molds, and animal secretions. Those were on the slide earlier, so I just put them in here to remind you. House dust mites. Contact allergies enter the body through the skin. They include things like powders, lotions, some metals such as cheap jewelry that have nickel in them, jean snaps and clips on bras, and latex. I have someone who works here who's actually allergic to latex. And the powders and lotions, it's really obviously a hit or miss, you know, trial and error type thing, because you don't know until you actually have it on your skin. Okay, you know, unfortunately, and then you have to take care of it. But there's a reason why your skin is reacting to it.
What about tape? What would the reason be for that?
For what?
Tape.
Tape? The glues. Like tape, scotch tape or something?
No, and like,
Medical
from surgery.
Oh, the surgical tape, same thing. It's the glues, it's the adhesive that's on it. And also sometimes because you put the tape on there, there's no breathing, depending on the type, it doesn't breathe. So what ends up happening is they'll get
But
irritated.
could there be latex in the tape, maybe?
There might be.
A lot of people
Yeah.
aren't, they do better with paper tape than they do with the latex.
The latex tape,
Oh,
right?
yeah.
Well, the latex tape doesn't breathe like the paper tape does.
But it's even if you have an EKG,
Mhm.
pads from that, I look like a target afterwards.
Yeah, well, it will irritate, the pad, you know, with the EKG, it's different because the pads that they use are much like electric stim unit pads. Okay, they have a watery type glue substance on them, and what happens is it's actually measuring electrical impulses, so if you have it on there for a while, and your skin is a little sensitive, it'll turn red. It'll turn red, so
Stayed
it's,
for a week.
Oh my
yeah,
God.
that's a long time.
I just had kinesio tape put on my neck. When I
Uh-huh.
took it off, my neck is from
It's
here
all
to
red?
here. Oh, it's tore the skin off.
Ooh.
Oh.
Yeah, it's.
So your skin
It's
might
raw,
be,
right?
yeah, there might be a thinness to your skin, there might be some nutritional thing that you have to look at, that might help with that. I mean, there could be a lot of reasons. I don't know your health history, so, you know, but there could be a lot of reasons for that. There could be a lot of
Just
reasons.
curious.
Yeah,
Like you said.
yeah.
Kind of stuff like
Weather changes, heat and cold, humidity, barometric weather changes, infections, I mean, you name it, you know, there's a lot of different factors out there. It's just, it's really trial and error, finding out what it is, and hopefully it won't kill you. You know, I mean, you know, but the thing is, but if you can help avoid, like these things here, you're not gonna be able to avoid, but the infections and the secondhand smoke, well, if your immune system is functioning properly, you wouldn't have that problem, but obviously there's some sort of sensitivity in your skin, but you have to look at some of the other factors that are surrounding it, but secondhand smoke, obviously, you can control, okay? Or you can try to. Wide range of potential signs or symptoms of allergy, and they depend on many factors. How it got into your body, the type of allergy, level of exposure, because there are different types of allergies. Okay, like we talked about, oh, someone's tired. Because these signs and symptoms may indicate the presence of another disease rather than an allergy, they should be investigated by someone who knows what they're talking about. Okay, we all can read and read and read, but sometimes the stuff you read can lead you to, oh, I must have this, I must have that, I must have, you know, it's scary. You really need to know clinically what the presentations are, and that's why I was saying to you, I don't know your whole health history, so there might be something underlying that might be causing that allergen, or maybe a nutritional deficiency, or not, or maybe something that you're eating. So there's definitely something that you have to get checked. These are some of the main symptoms. Again, you look at all these things, and I point out a few of them. Go back. Asthma, that's why the class is called Asthma and Allergies. This is a pretty easy one, itchy, watery eyes. Eczema is dryness in the skin or hives. This one people don't really pick up on that much, dark circles in and around the eyes. That could be a huge indicator of allergies, okay, especially for, depending on, especially food allergy. Shortness of breath, obvious, stomach cramps and diarrhea. Okay, if you have something like that, that's definitely something that's going on. As a chiropractor, this is what I've been talking about, creating optimal nerve function, allow the body to function properly. Other health problems may respond to chiropractic care because every system in the body is controlled by the nervous system, so that's what we work with. Research from the chiropractic standpoint, if you want copies of this, I'll send it to you, I'm just gonna read. An impairment rating analysis of asthmatic children in the chiropractic care. This was in '97, and it was a study of 81 children, and they looked at specific numbers, and they found that those in the chiropractic care did better. Chiropractic response in the pediatric patient with asthma. This is more of a pilot study. It was done by the Peets, and they were in Vermont for a while, using CBP or chiropractic biophysics, which is a technique that I focus on. It's biomechanics. And they found that people were doing better also. And then this is a specific type of technique, upper cervical chiropractic care. The brainstem area of the neck has respiratory markers that you can work with, and they measured forced volume and forced expired volume coming in and out, and they found improvements. So those are the big things. And this is the other one, Foundation for Chiropractic Education and Research. Like I said, I'm not gonna sit down and go through, but they involved about 420 patients here. I'm losing my battery here. Ultimately, the simple things is this. I have personal experience with it. I was in asthma. I was taking 10 medications when I was 25 years of age. I was on 6 for my migraines, I had 2 spinal taps, and I was taking 4 for asthma and allergies. That's not a way to live your life. You should look at every single pathway that you can possibly can to help your body function better. And it's not an immediate fix. You need to learn the techniques of breathing. You need to learn to, if you have a child that's having trouble breathing, getting them into the shower to moisten the area, to relax the area. You know, massage helps to relax the area. Chiropractic adjustments helps to open up the nerve fibers. There's you know, certain supplements that people are lacking nowadays. They're finding vitamin D is important for everything. We've got to make sure we have omega-3 fatty acids in our diet. We need to make sure that these things are in your diet. They're requirements. They're requirements of your body to be healthy. But ultimately, it's up to you to decide which ones you want to take and which ones you want to do. Okay? And then you have to look at the things you're exposed to, because you know what? Your body can only fight so much. If you overexpose it, it's gonna eventually break down. And it might be over many years, so don't expect a fix to happen overnight. Chiropractically, we start with the foundation of the spine and nervous system and then work our way from there. But for you guys, it's your choice the way you want to approach it. And for those of you who are patients, thank you. And for those of you who are guests, thank you. If there are any questions, I will stay for a few minutes after.